So, what is the most commonly overlooked cause of vertigo no one is talking about? Do you have a mystery case of vertigo? Have you been everywhere and had every test? Maybe even done a full course of vestibular physical therapy and you still feel dizzy? Have you been told you just have to live with this? It can be very frustrating. In this video, I'm going to expose the most commonly overlooked cause of vertigo no one is talking about. Make sure you stay until the end because I'll share a common risk factor that we all need to be aware of and I educate my patients about when they have this cause of vertigo. I'm the Vertigo Detective, and this is just a quick reminder that this video should not be considered individual medical advice. This is just education, information, and I offer it to provide you with hope that you can get your life back. Now let's get into the content for today. The most common overlooked cause of dizziness and vertigo, in my experience as a physical therapist for over 22 years and specializing in dizziness and vertigo since 2005, is the neck. When patients go get a traditional workup within the healthcare system, they're looking for problems with the brain, the eyes, the ears, the heart, and rightfully so, because those all require directed medical attention. However, if all of those tests and all of those specialists check out and no root cause can be found, in many cases that I've seen, the cause is an overlooked problem with the neck. To give you a little bit of background, the term cervicogenic dizziness is what we call dizziness from the neck. Why doesn't it show up? Well, because if somebody takes a scan of your neck, like an MRI or a CT scan or even x-rays, if someone images your neck, they're pretty much looking for pathology, some kind of disease, disc herniations, pinched nerves, things like that. But those type of images may or may not even be ordered in your case. And if they are ordered, they don't necessarily show the type of stiffness or alignment problems or muscle trigger points that can lead to dizziness or vertigo from the neck. In traditional care for dizziness and vertigo, the neck is not even considered as a possible root cause of dizziness or vertigo symptoms unless the patient is complaining of neck pain. So a couple key points I want to give to you today in case this is the breakthrough you need to get your life back. Dizziness or vertigo from the neck can be a result of head or neck trauma, such as a whiplash injury that occurred even up to 15 to 20 years prior to the onset of the dizziness or vertigo symptoms. And because a long period of time can pass between the traumatic incident that affected your neck and the onset of the dizziness or vertigo symptoms or attacks or episodes or whatever you might be experiencing, a lot of times patients and healthcare providers are not putting two and two together. So no one is connecting the dots because the timeline is too far apart. That's one thing to be aware of. If you have a history of neck trauma, such as car accidents, motorcycle crashes, anything like you fell down the stairs, anything where there was a trauma to the neck that might have caused a whiplash injury, even a concussion or something like that that happened maybe 15 to 20 years prior to the onset of your symptoms, that might want to get your attention. Is this related to my neck? The second thing that I found in my work that I want to share with you is that dizziness or vertigo from the neck can be a result of stiffness in the neck without a history of trauma or even current neck pain. So again, traditionally, we don't consider the neck unless the patient is talking about neck pain. But what I've found through working with many patients over the years with dizziness from their neck is if the patient has limited mobility in their neck, so they have a stiff neck, they can't turn all the way to the sides, they can't look up all the way. So there's some amount of stiffness in the neck mobility with turning and looking up, then that can be a sign that the neck is a root cause of the dizziness. And what I've found working through cases like this, what I call mystery cases, which is part of what I love to do as a clinician specializing in dizziness, is that once the patients mobility of their neck is restored to full function. So 90 degrees turning to the right, 90 degrees turning to the left, and hopefully 90 degrees looking up. If not, maybe they're older, so maybe 75 to 90 degrees is more realistic for an older adult. But typically we want to look at 90, 90, 90 for restoring motion in the neck. And once that mobility is restored, a lot of times my patients have a resolution of the dizziness related to their neck. So a key point here is that neck problems can show up from stiffness and cause dizziness or vertigo symptoms or even attacks without neck pain. And that's one of the reasons this is the most commonly overlooked cause of vertigo no one is talking about. The third key point that I want to tell you is that dizziness related to the neck is frequently due to an underlying cause, a deeper root cause that we want to look at, and that may need to be corrected for this problem not to continue to recur. Some examples would be improper ergonomics at your computer or poor posture. Maybe you're developing a forward head posture as you're getting older and your shoulders are rounding forward and your head is coming forward. That kind of forward head posture can contribute to the onset of stiffness in your neck and then be a deeper root cause of dizziness or vertigo from the neck. So again, if we want to look at resolving the symptoms at the deepest root cause, which is what my approach is all about to prevent dizziness and vertigo from becoming chronic or recurrent problems in someone's life, then I'm looking at their posture, I'm looking at their ergonomics, at their computer, whatever computer they work on, whether it's a computer at a desk or maybe a laptop, a tablet. How are they reading their books? What kind of hobbies do they have? Sometimes it's a hobby that might put somebody's neck in a chronic position that causes dizziness from the neck. Like, for example, video gaming or needlepoint or throwing ceramics, different hobbies or activities recreationally or even work related, like someone that works on a microscope in a lab all the time. These are different types of hobbies, occupations, and different types of recreational activities that may cause recurrent problems with the neck that might be a deeper and hidden cause of dizziness or vertigo from the neck. And so sometimes purchasing certain equipment to improve the ergonomics of working on the computer or certain recreational activities, occupations, or hobbies may resolve the neck-related issues altogether. I have had a handful of patients that actually had to switch jobs or switch careers if we were determining that their job requirements were putting them in a constant and chronic position of triggering dizziness or vertigo from their neck. And so that would be sort of a last resort, but maybe what's necessary in some cases to get their life back. Now, as promised, I want to show you an educational tool that I share with almost all of my patients. So this is the image that my graphic designer made for me. Shout out to Melissa. She's fantastic. And this is what we call the tech neck image. And so on this, what you can see here is that leaning forward is going to put more weight on your neck. So if you are holding your smartphone up at eye level, you can see that's 0 degrees of bending forward right here. And the head is going to weigh about 10 to 12 pounds. That's normal. Okay. That's what our necks are designed to support. However, as you start hunching over your smartphone more and more, further and further, maybe you don't even realize you're doing this. Your head starts weighing more pounds. And therefore, that's a major cause of neck pain, headaches, dizziness, vertigo, and even ringing in the ears. Now, as I mentioned, some people have dizziness or vertigo from their neck, but they don't have neck pain. They may just complain of neck stiffness. If they try to turn their head, it feels tight, it feels tense, maybe it clicks and makes noises, but they may not be having pain. And that is the reason, in my experience, that this is the most commonly overlooked cause of dizziness or vertigo no one is talking about. So again, when we look at 60 degrees leaning forward, The head actually goes up to weighing about 60 pounds. So that's putting a lot of weight on your neck, and that can be a chronic or recurrent cause of dizziness or vertigo symptoms from the neck. And again, that won't show up on almost every diagnostic test that is traditionally done in the healthcare system as a workup for dizziness or vertigo.